Hello everyone, I am Dr. Rajita, faculty of NEXTFELLOW. So today we are going to discuss about the pericardium of heart. So the pericardium is the covering of heart which protects the heart and allows the free movement of heart. And it also prevents the excess movements of hearts, means unnecessary movements of hearts, and also prevents the excessive distension of the heart. So if we see the pericardium, it has got the outermost layer which is called as fibrous pericardium. This is the fibrous pericardium which is green color, and you can see below it is along the central tendon of diaphragm. So it blends with the central tendon of diaphragm because fibrous pericardium is developmentally derived from the diaphragm, from where it derives, that is from the septum transversum. And inner lining, if we see this blue lining, we can see the double layered serous pericardium. So pericardium is basically of two parts, fibrous pericardium and serous pericardium. And serous pericardium, it is a double layered sac which gets reflected along the heart. So you can see the outer one is called as the parietal layer, and the inner lining which is along with the heart, that is the myocardium of the heart, is called as the visceral layer. And we can see these two layers reflects along the great vessels which are arising from the heart. And fibrous pericardium, we can see here, it is peripherally, which is derived from the septum transversum, and serous pericardium, parietal and visceral layer again. So the parietal layer is from the somatopleuric mesoderm because it is along with the body wall, and visceral layer development is from the splanchnopluric mesoderm. And the cavity, the potential space which you find between these two layers is called as pericardial cavity, which is filled with the pericardial fluid. Approximately it contains around 20 ml of fluid, and which acts like a lubrication around the heart, allowing free movements of heart. Contents of pericardium: it has got heart, which we know it, and apart from heart, the great cardiac vessels which supply the heart as well, and the nerves which supply the heart are present within the pericardium. And aorta, ascending aorta, which arises from the left ventricle, that is also partially covered by the pericardium. Pulmonary trunk, that origin of pulmonary trunk, and lower half of superior vena cava, means be just when it is terminating, and terminal part of inferior vena cava as well, and terminal part of pulmonary veins. Posterior to the heart in the base, there are 4 pulmonary veins which are also covered by the pericardium. So if we see the development, I said earlier, this is the fibrous pericardium, the green one, which is as such, which is not invaginated actually. This developing heart tube invaginates the serous pericardium. So serous pericardium is invaginated, making it into a double layered. So initially this is the large pericardial cavity. It gets thinned out here surrounding the heart, forming a thin potential space. So serous pericardium is reflected one, and fibrous pericardium is along with the heart. So if we see the relations and parts of the pericardium, so the pericardium has got the apex, base, anterior, posterior surface, and we are going to see its relations on anterior and posterior. Apex is towards the roots of these great vessels where it blends with the outer layer of the great vessels, and base is along the central tendon of diaphragm where it blends with the central tendon of diaphragm. And anteriorly it is related to sternum. We can see here, this is the sternum, and there are two ligaments which connects the posterior surface of sternum with the pericardium, called as sternopericardial ligaments. This is superior and this is the inferior sternopericardial ligaments. So these are anterior relations, and anteriorly we can see its extent from the sternum, that is from the second costal cartilages till sixth costal cartilages, it extends on each side. So second is present at the level of sternal angle. So the apex is present at the level of sternal angle. And posteriorly, when you lift this pericardium, posteriorly we can see here the arch of aorta continuing to form descending aorta. We can see the impression of it. So posteriorly it is related to the descending aorta and esophagus on the posterior aspect, and also it is related to the vertebra, that is T5 to T8 vertebral levels on the posterior side. And the trachea also bifurcates at the level of sternal angle. So the principal bronchi, that is the right and left principal bronchi, are also related to the posterior surface of pericardium. And on each side we can see the lungs. So on each side we can see the lungs, and along with the mediastinal pleura which covers the lungs, and we can see the blood vessels supplying the pericardium and the lungs, and phrenic nerves, right and left phrenic nerves, which descends down to supply the diaphragm. So these structures are related on each side of the pericardium. So discussing further on the oblique sinus. Oblique sinus is like a J-shaped sinus which is formed by the reflection of the serous pericardium. Of course we know that. And it is like J-shaped, you can see here, inverted J-like, reverse J-like. And it is enclosed within the, around the venous channels of the heart. So this is the superior vena cava, inferior vena cava, and these are the right and left pulmonary veins, right pulmonary veins and left pulmonary veins. So the visceral layer of the pericardium gets reflected along these vessels, forming this a cul-de-sac, that is J-shaped sac called as oblique sinus. So oblique sinus, anteriorly it is related to the left atrium of the heart because it is just present posterior to the left atrium. So anteriorly it is related to left atrium, posteriorly it is related to the parietal layer, that is the parietal layer of serous pericardium, and towards the right side it is related to the right pulmonary veins and inferior vena cava, and towards the left side it is related to the left pulmonary veins. And superiorly it is separated from these vessels by the transverse sinus superiorly by the reflection of visceral layer, and inferiorly it is open. So these are the boundaries of oblique sinus. So the transverse sinus is shown again here, showing its boundaries. Anteriorly the two great vessels, aorta and the pulmonary trunk, and posteriorly it is separated from the oblique sinus, we know now. On each side it is continuous with the pericardial cavity, that is the potential space between the parietal and the visceral pericardium, and it is present over the left atrium of the heart. So this is the transverse sinus. Clinically, transverse sinus is quite important during cardiac surgeries. After opening the pericardium, the finger is inserted into this transverse sinus, separating these two great vessels to ligate these two great vessels. So during ligation, this transverse sinus would be helpful for the surgeons to tie, to insert lung machines. Coming to the blood supply, nerve supply and venous drainage. So we know developmentally the fibrous pericardium is from the somatopleuric mesoderm, that is the septum transversum, and whereas the visceral serous pericardium, serous has got the parietal and visceral layers. So the parietal layer is again from the somatopleuric mesoderm because it develops along with the body wall, whereas the visceral layer, which is along with the heart, myocardium of heart. So visceral layer is otherwise called as epicardium. So this epicardium, that is the visceral layer, it is supplied by autonomic nerves because it is developmentally along with the heart. So the blood supply, fibrous and parietal gets a common blood supply, internal thoracic artery and descending branches from descending thoracic aorta, means pericardial branches. And visceral layer, it is supplied by the coronary artery which supplies the myocardium. Venous drainage, along with the body wall, it drains into azygous vein, internal thoracic veins, whereas the visceral layer drains into coronary venous sinus, which is drains most of the heart. Then nerve supply, Phrenic nerve which supplies the diaphragm, because developmentally fibrous pericardium is from the diaphragm and parietal is also, and it is pain sensitive because it has got receptors, whereas the visceral layer is pain insensitive and supplied by the autonomic nerves, that is vagus for parasympathetic and sympathetic nerves, forming coronary plexus or cardiac plexus. So that was about the blood supply. Here I can show you the internal thoracic artery. So this is the internal thoracic artery which is descending down from the subclavian artery. It is a branch of subclavian artery on each side of the heart, supplying the heart. Musculophrenic arteries. Descending thoracic aorta. See, this is the aorta which descends posteriorly, giving directly branches which are called as pericardial branches. Nerve supply, fibrous and parietal pericardium by phrenic nerve. So we can see this is the phrenic nerve, right and left phrenic nerves. And epicardium, that is the visceral layer, it is supplied by the autonomic nerves of the heart. So most important one of its applied aspect is the pericardiocentesis. Pericardiocentesis is a surgical puncture of the pericardial cavity for aspiration of the fluid. So a needle is inserted into the pericardial cavity, usually through fifth intercostal space. So please note down, through fifth intercostal space, left to the sternum, because heart is present on the left side. So at costoxiphoid angle. So at this angle we are going to insert the needle. So 1 to 2 centimeters deeper to the left of the costoxiphoid angle. The needle is inserted at an angle of 45 degrees and it is inserted then towards upwards, backwards, the tip of the scapula until it enters the pericardial sac. So this completes a very short topic on pericardium. Thank you.